Hi, I'm Jeff Mayers, president of WisPolitics.com and WisBusiness.com. I'm here today with Daniel Sem. He's the co-author and editor of a new book on our healthcare system. It's called Purple Solutions, a bipartisan roadmap to better healthcare in America. And I'm sure a lot of people would agree. There you go. Show the book, Daniel. Thank you. Professor Sem is well qualified to write this book. He's a dean and professor of business and director of tech transfer at Concordia University in Wisconsin in Mequon. And he's director of the RX think tank, which is focused on healthcare reform. So welcome, Daniel. Really appreciate you being here.
Thanks for having me, Jeff. Looking forward to talking about this.
So why'd you take on this project and why now?
I got tired of chasing windmills, but so my background is actually in biotech and pharmaceuticals, and then I sort of moved into business. So I've always had a passion for the interface of business and healthcare. And now as Dean of School of Business, it's become a big passion. For 4 years in a row now, we've had this thing we call the Healthcare Economic Summit, and we talk about healthcare policy. And me as a person who started out with a passion for healthcare, I think the biggest problem in America, of course, we need new treatments for disease, but it's just the dysfunctional healthcare system we have. So it's a way that I want to contribute with the platform that I have. So
right, and you have various collaborators in this book as well. How did you end up choosing those?
Right, yeah, and that was over the 4 years that we've had the summits. These are speakers that we've had at the summit. So these are prominent thought leaders, policy experts, politicians, but also healthcare executives, healthcare entrepreneurs, people that work at law firms, all over the map. I'm trying to take sort of I'm at a university. I'm trying to take an objective view of things and research it. And so the group of people I put together really are leaders. You know, I have a chapter from the former president of the American Medical Association. I have some chapters from Kurt Gilo with David Reamer, who proposed some interesting healthcare policy for Wisconsin years ago. So I'm just trying to cover the spectrum to honestly get at what could be solutions for healthcare.
Well, it's a monumental task. And I don't think we can talk about healthcare without talking about the coronavirus. And I'm going to read something from the introduction in your book. And we're talking with Daniel Sem, author of Purple Solutions. You write, as I write this, the jury is still out. I write this in December of 2019. As I write this, the jury is still out as to whether the U.S., a country that rightfully values freedom, liberty, and human dignity, will deal as efficiently with the pandemic as China and other countries, other Asian countries. So first of all, what's your answer to that? Answer to that question you pose? Is the jury still out, or is there an answer to that?
This is a really interesting question, probably a hour-long discussion on its own. We're dealing with a public health crisis, and there is a need at some level for government to intervene and help in a public health crisis. That is inherently going to infringe on liberties of individuals, which is what America is all about. So there's a natural tension there that just had to be. You can look at an autocratic society like China. I see some good things about China, but it's obviously autocratic, human rights abuses, and so on. That is an effective way to deal with the pandemic, but at what cost? So the question really is that where are we on that spectrum? And I think that's leading to a lot of unhappiness and debate and uncivility in the U.S. But it's because we are a country founded in a belief in liberty and a resistance to be told what to do, even if it's for the betterment of society. So this is basically a liberty issue, but maybe liberties are suspended a little bit for the common good. It'll be something fun to talk about for years to come after we're past this crisis.
Well, every country, there's like not just 50 state solutions. There's all the municipalities, there's all the county orders, there's and across the world, Sweden's doing something different from its fellow Scandinavian countries. It's great for research years down the road, but I guess you're saying it's hard to deliver a verdict right now. Is that what you're basically saying?
Yeah, I think so, and I think it's a balance. A believer in liberty myself. It's good to not manage things from the top down to sort of at the state and local level and to empower people. Hopefully people would be making decisions based on a concern for others and good science. So, you know, my personal perspective for what it's worth is maybe don't force us to wear masks, but I wish then most people would if they're helpful, but that's not where we're at. So.
Okay, so what's the outgrowth of this? I mean, I think it's obviously changing healthcare delivery, changing health. You know, the treatments are rapidly advancing. Vaccine research on this moving faster than ever before. You know, I guess why don't we talk about what some of the positive outcomes could be out of the coronavirus?
Right. Yeah, and that's more where my head is at, and I'm focused on healthcare policy. I actually think Singapore does a pretty good job of healthcare, and they're sort of a good model for us as well, that I'll talk about in a sec. But I think a good outcome, the COVID crisis has put incredible strain on the healthcare industry, something many people have cynically called the medical industrial complex because it's become sort of too big and powerful, and I would say anti-competitive. But also government regulations that are a little bit too restrictive. Because of COVID, we've moved towards using more telemedicine, more telehealth. I think it's been a adjustment for people in society, but I think a lot of the future of healthcare is that. Regulations have been loosened, so now that we can use telehealth, there were restrictions about state licensure across state lines. So the crisis of COVID has accelerated the adoption of technology that's coming in healthcare, which later on is going to include, you know, us owning our own medical records and being able to move wherever we want freely from provider to provider, which is not easily the case right now. So all of this pressure from COVID is accelerating the adoption curve for the future of healthcare, I think. And it's also weakening what some call the medical industrial complex, which, you know, is a lot of what my book is about and why healthcare is so darn expensive. If that gets weakened and we empower consumers and consumerization of care, I think that's the way to control costs. So COVID's accelerating that. You can look at Steve Glasgow, who's I think the #2 ranked thought leader in healthcare policy. He talks about this. So, you know, the disruption of our current healthcare model so that we can go to this more empowering the consumer.
So the disruption factor can lead, it's disrupting now, but the long-term effect could be better if consumers are activated and controlling their own destiny.
Exactly, yeah. And this is just accelerating it, so.
Well, except that during the ACA, you've had all these combinations of healthcare units and seemingly more powerful healthcare systems. So does that mean the ultimate breakup of all of these big systems that we have now?
Yeah, there's a few levels. I think it is. I would not be in favor of government controlling all of healthcare or big monopolistic corporations. I'm in favor of consumers. So yeah, I think there is anti-competitive behavior out there, and it's only enabled by the reimbursement model of healthcare that we currently have that is fee for service. So the more services you provide, the more hospitals and providers get paid, and they anti-competitively will refer only internally for procedures, surgeries that are more expensive than if they went outside. So it's absolutely not a competitive free market, and it's not universal healthcare. It's really the worst of both worlds. What we have, so.
Which is why it's expensive.
Yes. Yeah.
So, you know, I went to the doctor the other day, and I actually went to a facility because the telehealth thing wasn't enough.
Okay.
I had a skin rash. I'm explaining this to people. I had a skin rash from giving blood. And, you know, so I actually had to go see a doctor. So I went, there's nobody in the waiting room.
Okay.
You know, and I'm going like, the first thing I'm thinking of is, wow, we have these big facilities and there's nobody in them.
Yeah. That's a tremendous amount of overhead, and we're paying for that. So, I mean, 30% of healthcare, I think, is basically the hospital costs, and 20% is the clinical services. We could do that a lot more efficiently with smaller physician practices, which really offer better care at lower costs, but they're being squeezed out of business. We're paying for those big empty buildings with high technology.
Mm-hmm. Okay, so yeah, you know, our system is very complicated, very expensive, and it's, you know, and it's subject to a lot of local regulations and everything. But there's no simple fix to something I think this crazy. But is there a place where we can look for a model or a philosophy? You mentioned Singapore, which though is a very small homogeneous country. But I mean, can we really like follow Singapore? Or?
Yeah, and a lot of people will critique that argument for the reason you just gave, but just to highlight the Singapore model, that by the way, they spend 2.5% of GDP on healthcare. We spend 18%, and I have no illusion that we're going to get there, but I'd like to stay under 20. What they have is they have HSA accounts with cash in them that you can then purchase healthcare from. We're not far from that right now. That would be free markets and competition. So right now what we have are high deductible plans that have ridiculously high deductibles that people can't afford. What we should do, and David Goldhill talks about this in his book, Catastrophic Care, we should use insurance like insurance. We should use it for unusually rare and expensive things that happen, and then we should just pay cash for other things. So how could we do that? We could do that with HSAs. I think people are starting to move to that right now. You know, if you need to have a $1,500 deductible to do whatever procedure you need at the hospital, you should be thinking hard about, is there something else I might be able to do? Because I can tell you as a fact, most of the time when you have to pay $1,500 for a deductible, you can probably find that same thing for $300, $400, $500. That's just as good if you pay cash. So we should start moving in the direction that we already have momentum in, which is let's start using insurance like insurance and not like some sort of sponsored healthcare. And let's have HSAs to pay for the more routine things. You know, probably once every 10 years, you should have something, open heart surgery, cancer treatment, that's really expensive and you use insurance. Doctor visits, you can subscribe to these direct primary care for $50, $75 a month for a year. You have 24/7 access to a doctor. That's all I would ever need until something really bad happens. That's less than one copay that you have at an emergency room. So we should start paying cash from HSA accounts for regular care, and then we should start using insurance for more rare things. And sure, that could be the ACA, which already the bronze plan has an incredibly high deductible. So we should treat the bronze plan as catastrophic care, and we should just pay cash for things. The pieces are all there. We just need to put them together now.
Okay, so this is we try to keep these short and get people to read the book. So,
yeah.
But I'm going to ask this. You know, you talk about purple solutions, right? That's the name of the book that you're co-authoring and editing. So that means political solution, a political solution, and we have this election coming up. You in the book, I think you sound hopeful. Not exactly sure that there will be a purple solution, but maybe another outgrowth of this coronavirus crisis is maybe it could drive a real purple solution.
I think it's possible. You know, I'm not crazy, and I certainly don't expect, you know, Donald or Joe to compromise before the election because it's not going to suit their needs right now. I think the public wants a purple solution if they could hear it. They're just not hearing it. If they understood what this would look like, I think they would like it and they would force politicians. I see two ways to get to a purple solution after the election. One is if the public does it. So just like Uber empowered consumers, if we can somehow empower consumers so we get all of our healthcare off of this, then that'll force it to happen. And there are people trying to enable that if regulations don't get in the way. So we don't need politicians then. We just need them to not overregulate. The other way is both parties need to save face. I think what the Republicans have with price transparency, competition, and shopping could work. But I think what the Democrats have, which is universal health care at some level, but with tiers and competition, I think that could work as well. So I think what we need is both of those. So what could happen is a compromise where Republicans will concede, okay, we're stuck with the ACA, we don't like it, we'll have something universal, I'd like it to be private. Democrats can say, well, I don't think you should really shop for healthcare, but at least we got universal care through the ACA. So I think that's the way, it's saving face. So I deal a lot with Asian cultures and it's important to save face. I think politicians should care about the public first and getting reelected second. but I understand they need to get reelected. So just accept as a compromise a piece of what the other half has. That's my idea of a purple solution. They don't have to admit that the other party is right, but in their heart, I hope they can see it, and then they can concede. Because if we put together the two platforms in an intelligent way, we'd have something that works and it'd be a purple solution. And both Democrats and Republicans can do it reluctantly, but it'll be better for the public.
Okay. So, well, thank you, Daniel. How do you buy Purple Solutions?
You can get Purple Solutions on Amazon. So I also have a website, purplesolutions.org, that has a series of podcasts and other information. But, you know, look for Purple Solutions book on Amazon, and it's there.
Okay. Well, thank you, Daniel Sem. He's director of the RX think tank at Concordia University in Mequon. So thank you, Daniel, and we'll see how your purple solution arrives after the election.
Sounds good. Give me till 2020. Thanks, Jeff.
All
2021.
right.